Gynecologists of Reddit, what's the most disturbing thing you've ever seen? The following stories were originally posted on Reddit. All usernames, names, and identifying details have been changed or removed to protect privacy. Viewer discretion is advised. Story 1. Gynecologist here, 12 years in practice. You'd think by now nothing would surprise me anymore. And honestly, for a long time I believed that too. I've dealt with plenty of unpleasant cases over the years. Girls walking around for days, sometimes entire weeks, with a single tampon still inside. Necrotic tissue, severe infections that could have been avoided with basic hygiene awareness. You learn to compartmentalize. You develop a kind of emotional armor just to get through the day. But every once in a while, a case comes along that strips that armor completely off. A 19-year-old came into our clinic one Tuesday afternoon. She was alone, which already caught my attention. Most young patients her age bring someone with them. She was quiet, barely made eye contact with the receptionist. When she finally sat down with me, she said she had something stuck inside her and she needed help getting it out. I assumed it was the usual, a forgotten tampon, maybe a contraceptive ring that had shifted. Straightforward, I thought to myself, routine even. But then, very quietly, she told me the truth. She had inserted a hairspray cap inside herself, at age 15. That was 4 years before she walked into my office. She had never told a single person, not a friend, not a parent, not a school nurse, nobody. For 4 years, she had carried the secret completely alone, hoping somehow it would resolve itself. Before she even undressed, the smell reached me from across the room. I have been in medicine long enough that smells rarely affect me. This one did. I kept my face neutral, that is the job, but internally I was already preparing myself. What I found during the examination was beyond what I can fully describe here. The extraction procedure took over an hour. She cried the entire time, not from pain, though there was certainly pain. She cried from shame. Afterwards, she kept repeating, I'm sorry, and I had to sit with her for a long time before she calmed down. I referred her immediately to a therapist and a social worker. I still wonder sometimes how she is doing today. Story 2. I've been an OBGYN for 11 years. In that time, I have delivered over 2,000 babies, performed hundreds of surgeries, and sat with patients through some of the most difficult moments of their lives. You build a certain resilience. You have to. But resilience doesn't mean indifference, and some cases remind you of that very sharply. A woman came in, mid-40s, referred by her general practitioner for what the referral note described as routine concerns. Routine. I remember reading that word and thinking nothing of it. She came in alone, well-dressed, calm. She apologized for taking up my time before I had even said a word. That detail stuck with me. The moment I began the examination, I knew something was catastrophically wrong. The signs were unmistakable to anyone with my level of experience. I kept my voice steady and asked her when she first noticed symptoms. She paused for a long time before answering. Nearly 3 years ago, she said, she had noticed changes, discomfort, bleeding that wasn't normal, and for 3 years she had told herself it was stress, hormones, getting older, anything but what it actually was. What I was looking at was stage 4 cervical cancer, completely untreated, progressed so far that surgical intervention was no longer a realistic option. When I gently asked her why she had waited so long to come in, she looked at me very directly and said, I was afraid of what you might find. The fear of knowing had kept her away. She thought that if she didn't have a diagnosis, she didn't have a problem. She passed away 8 months later. She had a daughter in college and a husband who had no idea how sick she was until near the very end. I think about her every single time a patient tells me they've been putting off their appointment. Every single time. Story 3. This one still makes me uncomfortable to talk about even years later. A young woman, early 20s, came in with her boyfriend. From the moment they walked through the door, something felt off. I couldn't immediately identify what it was, just that instinct you develop after years of patient care, a kind of low-level alarm. He sat down next to her in the consultation room, and from that point forward, he answered every question I directed at her. Every single one. I would look at her and ask, how are you feeling today? And he would respond. I would ask about her symptoms, her cycle, her medical history. He answered everything. She sat perfectly still, eyes forward, hands folded in her lap, like she was waiting for permission to exist. When I asked him to step outside for the physical examination, he refused, flatly. Said he needed to be present for support, that he didn't feel comfortable leaving her alone. He said it pleasantly, with a smile, which somehow made it worse. I told him this was standard procedure and non-negotiable. He repeated that he was staying. I stepped out of the room, informed our front desk, and had a security staff member escort him to the waiting area. The moment the door closed behind him, the change in her was immediate. Her shoulders dropped, she exhaled. She looked at me for the first time like she was actually seeing me. What she told me over the next 20 minutes resulted in an immediate call to the authorities. I won't share the specifics, that is her story, not mine to tell. But I will say this clearly. If someone will not leave the room during your medical examination, if someone answers every question on your behalf, if you are not allowed to speak alone with your own doctor, that is not protection, that is control, and it's a serious warning sign that you deserve help. Story 4. 15 years in practice. I genuinely believed I was unshockable. Then one ordinary Wednesday afternoon, a woman in her late 30s came in complaining of persistent abdominal pain and bloating that had been going on for years. She was frustrated, exhausted, and deeply skeptical that I would help her because 3 doctors before me had already dismissed her. During the examination, I found something I could not immediately identify. It was encapsulated, partially absorbed by surrounding tissue, clearly foreign. We ran imaging, and there it was, a surgical sponge, left inside her body during a cesarean section she had undergone 9 years ago, at a different hospital. 9 years this woman had been walking around with a foreign object inside her body, suffering, being told it was anxiety, being told it was irritable bowel syndrome, being told it was psychosomatic. One doctor had actually written in her notes that she was a frequent complainer. She was not a frequent complainer. She was a person in genuine pain who was not being listened to. The surgical removal was complex given how long it had been there. Recovery was difficult. The legal proceedings that followed were lengthy. But what stayed with me most was something she said to me after her surgery. She said, "I knew something was wrong. I knew it for 9 years. I just couldn't get anyone to believe me." That sentence has informed how I treat every single patient since. When someone tells you something is wrong with their body, you listen. You do not dismiss. You listen. Story 6. I work at a clinic in an underserved area of the city. We see a lot of patients who have fallen through the cracks of the healthcare system. People who don't have regular doctors, who can't always afford care, who come to us when things have already gotten serious. It changes how you see medicine. It changes how you see people. A mother brought in her 16-year-old daughter one afternoon. The mother did the talking, said her daughter had been complaining of stomach pain and lower back discomfort for several weeks, probably just growing pains, but she wanted to be sure. The daughter sat in the corner chair and said nothing. She was wearing an oversized hoodie despite it being a warm day. She stared at the floor the entire time. During the examination, it became immediately and undeniably clear that this girl was pregnant. Not early pregnancy, approximately 32 weeks, 3rd trimester. The baby was healthy, positioned normally, and would be arriving whether anyone was ready or not. The mother's reaction is something I will not describe in detail. The daughter's reaction is something I cannot forget. She didn't cry. She didn't speak. She just closed her eyes for a long moment, like someone finally putting something enormously heavy down. She had been hiding a 3rd trimester pregnancy under baggy clothing for 8 months, through an entire school year, getting up every morning, going to class, coming home, pretending, completely alone with it. Whatever circumstances led to that situation were complicated and painful and far beyond the scope of a single clinic visit. What I made sure she knew before she left was that she was not in trouble with us, that we were there to help, that she was safe. Sometimes that is the most important thing you can say. Story 6. A patient came to me in her early 50s. She was warm, funny, the kind of person who makes small talk easily and puts everyone around her at ease. She mentioned almost as an afterthought near the end of our initial conversation that she had a small irritation she'd been managing at home. Probably nothing, she said. She almost didn't mention it at all. When I examined her, I had to concentrate deliberately on keeping my expression neutral. What she had casually described as a small irritation was one of the most severe cases of untreated infection I have encountered in my entire career. The tissue damage was extensive. The infection had been progressing, unchecked, for well over a year. She had been treating it herself,